According to the American Heart Association website, about 92% of all sudden cardiac arrest victims die before reaching the hospital. But statistics prove that if more people knew CPR, more lives would be saved. Most of us have all taken a CPR class at some point in our lives. Due to its medical nature, it is constantly changing, and it's important to keep up on the procedures and research every 2 years. Again, according to the American Heart Association website, the use of CPR dates all the way back to 1740. Yet even today, most Americans do not know how to perform it. I am required to stay current on all the new techniques for my job and also as an instructor for basic life support, and I'm an AHA certified CPR instructor. Today I'm going to be talking about the steps of adult layperson CPR. A layperson is a non-medically trained person. CPR stands for cardiopulmonary resuscitation and is defined as an emergency procedure combining chest compressions and rescue breathing in an effort to reverse cardiac arrest. CPR is performed in an attempt to reactivate the heart. While CPR alone is not likely to restart the heart, its purpose is to generate oxygenated blood throughout the body and to vital organs, especially the brain. The first step of CPR is checking for responsiveness and breathing. To do that, you want to shout, "Are you okay? Are you okay?" by gently tapping or shaking the victim. If there's no response, you want to lay the victim on their back and check for breathing. Gasping breaths are not adequate breathing. If they are not responding and not breathing, you want to call 911, or if someone is near, have them call 911 and get an AED if one is available. Not much time is spent on this step because the next step is so important. The next step is chest compressions. Chest compressions are performed by placing the heel of one hand in the center of the chest over the sternum between the nipple line. You interlock the fingers of your other hand and compress the chest at least 2 inches at a rate of at least 100 compressions per minute. It should look like this. It is important to remember while doing chest compressions that they are not effective if they're done on a soft surface, as of a bed or a couch. Also allowing for complete recoil of the chest after each compression. In layperson CPR, this step can be continued, or you can move on to the next step. If you continue this step, you're going to be doing continuous chest compressions until EMS or an AED arrives. Rescue breaths are performed after 30 chest compressions. You want to tilt the head and open the airway, doing a head tilt chin lift, making sure you do not tilt the head back too far as that can cut off the airway. You want to plug the nose and give 2 breaths. After the 2 breaths, you want to make sure that you go straight back to chest compressions. While giving the breaths, you might want to make sure they're of adequate volume, not too big and not too small. You want to perform these steps, 30 compressions to 2 respirations or breaths, until an AED or EMS personnel arrive. I hope that everyone has learned about CPR and how to perform each step. The Mayo Clinic, a leader in the national medical practices, states it's far better to do something than nothing at all if you're fearful of your knowledge or abilities aren't 100%. Remember, the difference between you doing something and you doing nothing could be someone's life. I encourage all of you to take a CPR class. Who knows, maybe you could save a life one day.